I am Tammi Pierson, the Director of Sales and Marketing for Dicor. I would probably consider myself like the product expert, so I will be going over the details, the specifications, and more the logistics of our hoverboard, just to have a real clear understanding of what our hoverboard does in brachytherapy, the Zephyr HDR, and why it is a must-have for your program. We've kind of already covered the agenda as far as the introductions, the presentation, which I will be doing, and with Tracy, and then the live virtual demonstration with Kevin, and a question and answer after that. We're going to focus on our Zephyr HDR or our hoverboards, and what our hoverboards allow you to do is to transfer your patient immobilized throughout the full radiation therapy process or department. Our Zephyr consists of a blowing mechanism or a lifting mechanism that lifts up the patient with high volume, low pressure air, allowing you to easily transfer that patient while they're in a mobilized position from the gurney or stretcher onto your treatment couch or image couch. You'll see here our Zephyr HDR. It's made of a rigid hoverboard, so you can allow those stirrups to be mounted to it. There are minimal artifacts, and you can also use this hoverboard in all modalities, CT, PET-CT, and MRI up to 3T, even with stirrups. Oops, that wasn't intended. We have nearly 400 systems worldwide. We've been developing this Zephyr hoverboard for over 15 years. We initially started in the radiation oncology market with our Zephyr HDR that we're covering today, but we also have external beam products, and we also have now launched another product line in the diagnostic imaging arena for trimodality, surgical IMRI, and hybrid operating rooms. You'll see our global market here. We're all international and quite a few in the European area. And you'll see our hoverboard is very simple. It lifts the patient and allows you to transfer onto different surfaces and modalities that you're looking for. Our oncology family of hoverboards consists of the Zephyr HDR, which we're going to focus again on today, but we also have 3 other systems that work in the external beam for photon and proton in that arena. Main components of the hoverboard are the hoverboard and any accessories that may be needed for a mobilization. And then we have our stretchers or gurneys. We have our air blowing accessories, and then also flat tabletops for the different image couches. Drilling a bit deeper into the Zephyr HDR itself for brachytherapy. This is a torso or a shorter board that also includes stirrups that can hold that patient in the lithotomy or legs up position throughout the full procedure. It includes a patient cushion for comfort. Here's the air inlet that the blower will be connected to. We have top safety guides as an accessory. We really talk about later on this handle accessory rail and how you can use it for other items as accessories, such as the stirrup. The stirrups can also be mounted on this accessory rail. The Zephyr HDR includes 2 patient cushions and also a footrest. The footrest is used in the event you want to take the legs out of the stirrups and go into a frog leg or supine position for treatment. For the footrest, it's easily inserted at the bottom of the hoverboard and then locks into place. There's a gap here intentionally for those GYN patients and the insertion materials. You'll see that shortly. The underside of the Zephyr HDR, we have 3 air bearings for balance, and we can lift up to 350 pounds with stirrups, 450 pounds or 204 kilos if you use the bariatric stirrups or use our footrest. The 3 air bearings are for balance, and also on the underside of our hoverboard, we have bump-ons. Those are used when you're not hovering and placed onto that flat, secure surface, so then you can go into a Trendelenburg or tilting position in your patient positioning. The Zephyr HDR is made of Kevlar material with Roacell foam, which provides that image quality that we're looking for. One of the accessory items that we can mount onto our accessory rail is an arm board for those anesthetized patients. It easily locks into place and then mounts onto the accessory rail or handle. We also have on our accessory rail, we have safety straps. These are inserted directly on the rail and then also secure your patient onto the hoverboard as you're moving around the department and through throughout their procedure. We also include handles. Oops, this is spinning for a minute. It also includes, or not includes handles as an accessory. In the event you want something more than the accessory rail itself to hold for your patient transfer, handles also can be inserted on this accessory rail. Also on this accessory rail, you can mount steppers. You'll see here we've got a Civco stepper for those prostate treatments. And then on the right side here, you'll see the stepper being mounted onto a side stepper being mounted onto our Zephyr HDR. And this is Dr. Casas shown in the background. An accessory we have is a universal clamp bracket, which allows you to remove that butt board that slides underneath your GYN patients or your female patients for the articulating arm. We remove that and have a universal clamp bracket that allows you to have free adjustment instead of interfering with the patient's positioning underneath their butt. The Zephyr HDR also has a very large area that is artifact-free down in that pelvic region to make sure we cover everything from the perineum up to the lung cage to make sure we're capturing that proper area. Inside this artifact-free area are plastic screws. Outside are brass screws, so it's still safe to go in MRI. Here are images of our Zephyr HDR in CT and both MRI, and you can see the image quality is excellent and it's artifact-free. We also have stirrups as an accessory. We have both CT and CT-MR stirrups. We have 250-pound stirrups for pediatric, and we can also go up to a 500-pound bariatric, but our MR stirrups are for 350 pounds. We've removed the Velcro, and they have silicone strapping for ease of cleaning. And also another nice accessory is a push cart for storage of those stirrups because they do become bulky when they're not in use. Our Zephyr HDR does go into MRI in lithotomy position. You'll see here you come in with our stretcher. We have a bridging mechanism on both stretchers that allow a safe patient transfer onto whether it's a CT couch, treatment couch, or image couch, or MRI couch. And you'll see here the stirrups are tested up to 3T in MRI and maintain that same positioning throughout. So either way, whether you're CT or CT-MR based workflow, you can maintain that lithotomy position, or if you choose, you can remove the stirrups and place that patient in more a supine frog leg position for your procedures. Again, our stretchers have a bridging mechanism that allows a safe, solid transfer to and from the different departments. Our MR stretcher or MR stirrups, we designed a unique stirrup clamp that gives you a narrower profile, which allows the Zephyr HDR to go deeper into that MR bore because you need to get in that area of interest. So now you can get into that area of interest with these narrower profile MR stirrup clamps. And here you'll see our Zephyr HDR with stirrups in an MR environment. And here are images with our MR stirrups, Zephyr HDR in an MR environment. And again, the image quality is excellent. We also have, for our footrest, we do contour our footrest to certain MR site systems because they have contours in the footrest area or leg area for their MR coils. So you'll see here, we have also unique footrest contoured to go around those MR coils, depending on who your manufacturer is and if needed. Key features of our stretcher. I didn't highlight it so much in the videos, but Kevin can in actual. Our stretchers both have bridging mechanisms. This procedural stretcher has a translating top that allows a flat, solid surface from the stretcher onto whatever other surface you're going to, whether it's CT, MRI, or a procedural couch, or even in an operating room on an operating table. We have adjustable height and fifth wheel steering for easy navigation throughout the different corridors. The weight capacity is 600 pounds for our stretcher. For our MR stretcher, you can go into a 3T environment, and here, instead of a translating top, we have a bridging mechanism that lifts and again allows you to have a safe, solid surface for that patient transfer, for your clinical staff, and to make sure your procedure and the insertions maintain in the same location as you're moving that patient throughout the department and their procedure. Again, the weight capacity is 600 pounds. And we also have steering assist where we have locking mechanisms on the caster, so you can either treat it like a shopping cart or have free flow. We also work with the main mobile CT providers, such as the Elekta Imaging Ring, the Samsung Body Tom, and then the Stryker Aero mobile CTs. And here is an image showing our patient transfer in an MR arena. And you'll see the bridging mechanism, and here they're transferring onto an MR or onto a surgical or OR couch.